Good morning. Welcome to the question before us of United Way. I'm Julie Design. I'm the Chief Program and Policy Officer at United Way. This is our third installment of this series where we discuss important issues for our community and together begin to find solutions for how to address them. Our first two events received excellent feedback. If you're interested in checking them out, we're not able to join, please go to United Way's YouTube channel. The link to that will be in the chat. These programs would not be possible without the support of Eden Hall Foundation. Eden Hall supports United Ways, not only so that we can do our important work, but also gives us important platforms like this one. So thank you, Eden Hall. It almost seems like a different world when we think back to the very beginning of the pandemic, those early weeks and months. Most of us were stuck in our homes, in our apartments. We were frightened to venture out. We were cut off from the rest of the world. In other words, we were living like many seniors live all the time, even before the pandemic. We felt isolated, uncertain, confused. And our older loved ones felt even more. Today's session will focus on how ongoing impacts of the pandemic have intensified issues and created whole new sets of challenges for older adults and caregivers. Our older neighbors who bore the brunt. This is the pandemic, living with my dog, of course, I picked this very moment to bark. Our older neighbors bore the brunt of the pandemic's pain and suffering and are now at risk, as most of us are starting to come out of the pandemic. So how do we shift our priorities and help ensure that our older neighbors receive the care and attention that they need? And what about those most vulnerable who are greatly impacted, but often overlooked? These are the questions that are before us today. And to help us sort through them is our highly respected panel led by Dr. John Wilds, one of my favorite people. And for those of you in the audience, we welcome your participation and encourage you to post comments in the chat. Dr. Wilds is the former Assistant Vice Chancellor for Community Relations at the University of Pittsburgh, where he received his bachelor's, master's, and doctoral degrees. He's also been deeply involved with United Way for many years, including serving on our board of directors. So Dr. Wild, so very glad to have you here today, along with this outstanding panel, and take it away.
Thank you, Julie. And thank you for providing this forum on a topic that will affect all of us. Both the growing number of adults who find themselves in the role of part-time caregivers part-time caregivers and those of us who plan to live a long life. Older Americans have been impacted far more from COVID than the population as a whole. Seniors continue to be more at risk of serious illness and hospitalization. More than 80% of deaths attributed to COVID have been Americans 65 and older. The pandemic continues to disrupt normal health care resources, delaying necessary procedures and sapping resources. Staffing shortages, overburdened facilities have created backlog and substandard conditions for people suffering from non-COVID diseases. As you know, there has also been a huge labor shortage across the country, none more acutely felt than professional caregiver and health workers who attend the needs of older Americans. All of this has led to the steepest decline in life expectancy since World War II. Life expectancy has gone down 1.4 years for white Americans, 3.2 years for Black Americans. It's more than mortality and physical health. The pandemic has also taken long-term toll on mental health. Widespread social distancing and preventive measures have increased isolation for older adults. While these steps have been necessary to minimize the spread of the virus, the negative psychological and social effects are evident. More than 46% of seniors have reported depression and stress related to COVID. In those over 65 years, being lonely and isolated is linked to higher mortality rates in general. And who is attending to their needs? Well, during the pandemic, responsibility for caregiving fell more and more on the sons, daughters, and relatives and friends. The pandemic thrust more first-time caregivers into caregiving roles than ever before. Seniors lost much of their formal and informal support system. In addition to relying on caregivers, the use of technology to attend medical appointments, shop online, and stay in touch with family and friends has become an important way to safely participate in daily life. On the flip side of this change, older populations have much less access to technology than younger adults. This discrepancy in broadband access and skill is known as the digital divide. So here today to join in a discussion about all of these issues is our distinguished panel. First, I'd like to welcome Alexis Miller, who is joining us from Highmark, where she is Market President for Federal Markets. And today, Alexis is invisible because she's having a problem contacting us via video. However, she is here. She is responsible for managing Highmark's Medicare individual, Medicare employer group, and ACA individual business. Alexis joined Highmark in 2006, where she previously led growth of the Medicare Advantage business. In addition to serving on the United Way leadership team focusing on seniors, Alexis is active on several boards, including the Regional Learning Alliance, the Senior Specific Strategies for Improving Member Experience. Thank you for joining us, Alexis. Our next panel is Dr. Trisha Gadson. Dr. Gadson is the Chief Executive Officer of Macedonia Family and Community Enrichment Center, a community-based organization that specializes in engaging and partnering with families and communities that utilize racial equity service model. She has a PhD from Point Park University, a master's degree from Carlow, and a bachelor's in psychology from Syracuse. And the New Pittsburgh Courier has named her as one of Pittsburgh's 50 Women of Excellence. We are fortunate to have her here with us today. And to round out our panel is Julian E. Gray, who is the founder and managing attorney for Julian Gray Associates located in Greentree and McMurray. Julian is a certified elder law attorney and has provided counsel and assistance to families dealing with elder legal problems for more than 25 years. A frequent author and lecturer, Julian received an undergraduate degree at Penn State and his law degree from Duquesne University. He has been recognized multiple times as a Pennsylvania super lawyer and one of the best lawyers in America in the area of elder law. So thanks to all of you for joining us. And as a reminder for our audience participants, please feel free to put your questions into chat and we will get to as many as we can. So let's begin. Our first question to the panel will be, from your perspective, how has COVID impacted access to healthcare services and other essentials for older adults? Julian?
Good morning. Good morning. Hopefully you can all hear me. And thank you for the introduction and the ability to be on this panel this morning to share this information. By way of background, healthcare is a big field, right? My particular specialty is in helping elderly people and young people with long-term disabilities. So I'll address your question based upon that perspective and hear what the others have to say. Obviously, we've noticed a change and a real difficulty in accessing long-term care facilities, both for residents as well as family members. We all know that there have been real problems over the pandemic, in getting people to be able to visit loved ones, family members, and this has further, stretched the pandemic's reach, so to speak, among all of us. And then from the, the home and community-based perspective, we work with a lot of elderly people who use programs such as the Aging Waiver Program here in Pennsylvania and other types of services. And those services are stretched very thin as well. Many of our clients who try to get home care, whether it's through a private resource such as private caregivers or through a medical assistance funded waiver program, have found that there just aren't caregivers available. So that's been a very big challenge that we've noticed. It's not only getting into the programs or securing people to help you, it's getting the workers there that have the ability to assist you. The other thing I would say about impacting access to healthcare that we've noticed is that because of the high percentage, and you had mentioned that people over the age of 65, and obviously people in nursing homes suffered the greatest losses of life, because of COVID infection throughout this pandemic. And it has scared many, many people. And I think it's changed the perspective of how people look at long-term care facilities. And, I feel like from what I've seen and my access to people who work in the long-term care industry from the corporate level is that it's almost like after, an easy analogy would be, after a restaurant is cited for a health violation, is probably the best time to go to that restaurant, because it's probably going to be squeaky clean. And so we've taken the position that I think it's correct, is that these long-term care facilities are probably the most sanitary, safest they've ever been in their existence because of this pandemic. So that's been a positive change that we've noticed. And I think that from the public's perspective also, we should take that into consideration, that these are much safer facilities because we've paid much closer attention now to keeping them safe because of COVID.
Thank you. Trisha?
Good morning, and thank you also for inviting me to this important conversation. And I appreciate being in the presence of such esteemed and knowledgeable colleagues. I think, John, that your question is extremely important to frame from the understanding that access to healthcare from a community-based perspective is framed from a holistic approach. So as a community-based service provider or a practitioner, we think about access to healthcare in terms for senior adults from the perspective of access to interaction with community partners that help make healthcare or the access to healthcare plausible. So once the onset of the pandemic hit, you had seniors who were nervous about even coming outside the door. Julian pointed out the increased anxiety that senior citizens felt as a result of recognizing that they fell into the classification that we knew early on were high-risk categories. And so there were concerns about, how do I get to my healthcare provider in a safe way? How do I assure my safety once I'm there? And so some of these unanswered questions, the unknown that we found ourselves in at the very onset of the pandemic, really increase the anxiety levels that the seniors were facing, as well as their caregivers, in terms of, how do I operate in my normal day-to-day so that I can assure that the overhead of my household is taken care of, as well as providing support to my senior loved ones. Some of the additional pieces that seniors were struggling with were just in terms of transportation. How do I get there? During the onset of the pandemic, and then even earlier this calendar year, when vaccinations were made available to senior citizens, there was just even anxiety about, is there transportation? How do I assure that I can get the first round of the immunization and the second round? And how can I get it safely? How can I get access to the technology that's needed to schedule an appointment? So all of these factors weighed heavily on both the seniors that we support as well as their caretakers. John, you're on mute.
Alexis, I'm sorry. Alexis?
Yes, Yes, thank you, and I apologize for not being there by video. You know, I agreeing with my fellow panelists, you know, generally speaking, older adults have a higher prevalence of emerging and ongoing health conditions that need to be managed. So you can imagine that anything that disrupts the services that allow the older adults to manage those conditions will have a bigger impact. So when COVID hit, many avenues to healthcare services shut down. We talked about this. You know, many physicians and hospitals cut back on services as they made room for COVID cases and were rightfully focused on controlling the spread of COVID. Transportation channels cut back. People were encouraged to stay in their homes. From a health insurer perspective, we could see this happening, you know, through a drop in the claims activity. So mid-2020, we saw drops in preventive services such as colorectal screenings and mammograms, saw similar drops in condition management activities. So think hemoglobin A1C check-ins for diabetes, you know, blood pressure check-ins for hypertension. We saw a deferral of elective procedures. You know, not surprisingly, we also saw a big drop in new diagnosis because older adults weren't being seen by physicians as much. Now, later in 2020, as things opened up a little bit more, as people ventured out of their homes, and as we'll talk about in a minute, as the use of telephonic and video health services increased, we did start to see preventive services and condition management services pick up again. We also started to see new diagnoses show up, but the diagnoses were then more severe, indicating the negative impact of that, you know, earlier preventive care being delayed even for a few months. Later on in 2020, and then more so once the vaccine became available in 2021, we saw elective procedures return. But similar to what we saw with the new diagnosis of chronic conditions, those elective procedures started from a more acute place. So, you know, more severe, more complications, et cetera. I'd say that, you know, while most health services are now back to pre-pandemic levels, although I'll say we are seeing some fluctuation in services due to the Delta variant, you know, there are other longer lasting impacts that we need to understand better and that, you know, are going to be the subject of later discussion on this panel. So virtual visits definitely became a new avenue through which to get services. We need to think through how to improve and maintain the right balance with in-person services. Mental health impacts and, you know, other impacts we haven't seen emerge yet.
John, you're on mute.
And Alexis, can you talk specifically about the pandemic's impact on mental health and behavioral health needs of older adults and their loved ones over the past 18 months?
Sure. You know, the impacts that COVID has had on mental health have been mixed, you know, not only depending on personal and neighborhood characteristics of the older adult, but also on the phase of the pandemic. So in early days of the pandemic, we know through our outreach calls and other interactions that, you know, older adults in total experience a higher rate of adverse effects on their mental health than younger population. Greater feelings of social isolation by being confined to the home, you know, more fear and anxiety regarding health safety. But like we saw with other conditions, new diagnosis of mental health conditions, including depression and anxiety, hit an all-time low in the early months of the pandemic because those older adults weren't being seen. Different than we saw with other conditions, as in-person care started to open up and new diagnoses started to reappear, we didn't see that same increase in severity with those new diagnoses. You know, this suggests that as a group, older adults may be more resilient to some of the anxiety, depression, and stress-related mental health disorders than other age groups. That said, as we've been able to study the mental health impacts from COVID over a longer period of time, we are seeing that social isolation is taking a higher toll on some older adults. So, you know, Highmark conducted a study on social isolation and diseases of despair in our older adult Medicare Advantage members, you know, through the end of 2019 into September of 2021. And found that high social vulnerability may worsen the effects of the pandemic on social isolation and mental health. So for Medicare Advantage members, for our older adults living in neighborhoods that were rated high social risk, you reported rates of severe social isolation, increased dramatically during the pandemic and remain elevated even now. This contrasts with members living in neighborhoods with moderate or low social risk, whose rates of social isolation were more stable and then even tended to decline in 2021. That same study found that rates of diseases of despair, so diagnosis related to alcohol abuse, substance abuse, suicide ideation and behaviors, tended to be stable during most of 2020, but then increased across the board between 20 and 21. And when we looked at the cross-section of social isolation and diseases of despair, we found that members living in high social vulnerability risk neighborhoods had the highest rates of diseases of despair overall, and also the sharpest rates of increase during COVID. In terms of the second part of the question, what can be done about it? We need to remember, and I think everybody on this call knows this, social isolation with or without COVID is definitively linked to a decline in physical health. So significantly increased risk of premature death from all causes associated with 50% increased risk of dementia, 29% increased risk of heart disease, et cetera. And we certainly don't have all of the answers, but believe that engaging the community and community organizations is key to supporting individuals struggling with social isolation and other determinants of health. A few things we've done on that front. At Highmark, we've implemented a social determinants of health universal screening assessment, which includes assessment of social connections in order to help us identify and help navigate the social needs of our members, advancing programs and supplemental benefits to directly impact social isolation. So the PALS program, People Are Able to Lend Support, a volunteer program, and Papa PALS benefit, both designed to support things like companionship, short distance transportation needs, targeted actions to reacquaint members with their community. And then long term, we're working to build a social care network where we can more formally and consistently incorporate community-based organizations into a member's care plan.
Okay, thank you. The next question, how has COVID's impact been the same or different for Black and Brown older adults in the community? And I'll ask Trish and Alexis to respond to these questions, to this question. And Trish, I'd like you to go first.
Sure. Thanks, John. I think that's an important question to consider. So one of the things that has been evidenced prior to the pandemic is the significant disparities in communities of color as they relate to social determinants of health. The pandemic has illuminated structural inequities that exist in systems across our country, which include healthcare, transportation, digital access. So a few minutes ago, Alexis referred to communities that are described as high social risk and the link to increased social isolation. What I would offer is that the digital divide that exists in under-resourced communities that intersect with communities of color are significant to understanding that we have been seeing disparities as a result of COVID-19 in communities of color. I attended a meeting on Friday in which the Hill Community Development Corporation reported that 60.3% of Hill District residents earn less than $25,000 a year. So that wealth disparity translates to the way that senior citizens can access things like high-speed internet. So when Alexis was talking about the shift as a result of the pandemic to telehealth and the need for utilizing technology to access healthcare and other important resources that tie into the decrease of impact of social isolation, one has to look at the way wealth disparities tie into the access of resources. So if you just take the digital divide, for example, you're looking at the ability to access technology as well as skill levels. And so what was needed for organizations like mine, community-based organizations that focus on racial equity as an integral part in service delivery, it was necessary to, first of all, recognize that communities of color or seniors of color are more likely, because of comorbidities, are more likely to be in a higher category or a risk of being impacted by COVID from a health standpoint, but also the impact as a result of social isolation because of not even having the technology to be able to connect with counterparts. And so it was necessary to focus on delivery in terms of increasing access, but also increasing the skill level to utilize the resources that are needed so that seniors can impact. So in short, your question about does it impact or how has it impacted communities of color, I would offer to you that it has been a significant impact. In terms of data to support that, what we've noted within my organization is that we've seen, especially at the height of the pandemic, we've seen a 50% increase in requests for toiletries and supplies. We've seen a 50 to 70% increase in the need for food, recognizing that food is medicine and is nutritious food is needed for seniors. And so being able to assure that this could be delivered to seniors. And so we have seen significant requests for increases in communities of color throughout the pandemic.
So Trish, what are we doing or should we be doing to address racial disparities?
That's a really important question. And so while in this venue and in others, we focus on increased service delivery, which is most definitely a part of the strategy to address it. But when you're really talking about racial disparities and you're talking about the need for racial equity and racial justice, we're talking about policy. We're talking about reframing the way that we approach our practice to engaging communities of color. We are talking about the way that we discuss and strategize delivery methods. We are talking about the way that we reframe our practitioners in acknowledging that race is a factor more than just a statistical box that you check on forms, but acknowledging the impact and the data from generations of policies that manifest in a way that you're seeing in the life expectancy of our neighbors. We should be focusing on thinking more holistically about the way that we create policies so that we begin to decrease the likelihood that your zip code can determine your life expectancy. We should be talking about policies in a way that decreases the likelihood that your neighborhood determines whether or not you have access to fresh food and that you have transportation and other resources that promotes better access to important health care.
Thank you. We have a question. Can you say more about what qualifies the community to be identified as high social risk? Trish, you want to take a crack at that while you're there?
Yeah, and then I'll encourage Alexis to also join in because she referred to this specifically. But in terms of from a community-based perspective, when we talk about the social determinants of health from our perspective, we look at all of the factors that impact our community members' lived experience and how that ties into their overall health outcomes. So we're talking about access to, for our perspective, access to affordable housing, access to markets that offer fresh fruits and produce for seniors, transportation that enables seniors to be able to obtain their prescriptions, the opportunity to live in communities where the infrastructure is built up, housing is stable, where there is access to neighbors in a safe way or services in a safe way. So from a community-based perspective, we look at all of the resources that support the health and well-being of the seniors who are living in a community.
Thank you. Well, Alexis, I'd like to have you respond to the question with regard to how COVID impact has been the same or different for Black and Brown older adults in the community, and what are we doing or what we should be doing to address racial disparities?
Sure, and I will also start by wholeheartedly agreeing with what Trish said in terms of that the high social risk neighborhoods. There is actually a national index on social vulnerability that looks at socioeconomic, household composition and disability, minority status and language, and housing and transportation, and sort of creates a ranking, an index, if you will, of the various neighborhoods. And that's that information was used, as I'll talk about in a minute. The information was used in order to assist with vaccine distribution.
Okay.
So, going to the question of the impact of COVID, on our Black and Brown older adults in the community, as an insurer, we have access to race and ethnicity information that our members voluntarily provide through the insurance application and other processes. Because it's voluntary and collected at a time that's removed from the point of service, so, not in a doctor's office, not in a hospital, we don't have consistent race and ethnicity data for all of our members. We do, however, have the most collected for our older adults. About 80% of seniors supply this information, but still with only 80%, providing the data, there is likely bias to any insights we draw from the data. So I just kind of wanted to caveat that as I talk through this. Aside from the important connection that to high social risk neighborhoods that Trish and I have already spoke about, we don't yet see any conclusive data that older Black and Brown adults were hit harder by COVID, but we do have some anecdotal data that would suggest there isn't a single yes/no answer. And I think that's consistent with our conversations here about the various communities and neighborhoods and the differences of the impact. So the first anecdote is that, in aggregate, we do see some evidence that some of our older adults of color have actually utilized virtual health services at rates comparable or even higher to that of our white members. So as we'll discuss in a minute, we saw a large increase in virtual health visits for our older adults, across the board in 2020. And of those who reported race, we saw that 50% of our Black and Brown members had at least one virtual visit in 2020, compared with 44% of the white members. So given the data bias I mentioned and the number of our Medicare Advantage members who don't report race, we can't draw an overarching conclusion, but there is some evidence that at least some of our Black and Brown members were able to navigate virtual visits to secure health care during the pandemic. Now, the second anecdote would suggest that, some of our Black and Brown older adults were impacted more by COVID, at least in terms of what was needed to distribute the vaccine. So early in 2021, Highmark partnered with Allegheny Health Network to distribute more than 300,000 doses of the COVID vaccine in and around Allegheny County. And we were ultimately able to achieve a distribution that followed pretty close to Allegheny County's overall proportions of white and people of color for our older adults. But we were only able to do that by dramatically changing our outreach, education, and sign-up approach. So, we partnered with churches, community centers, handed out flyers, took sign-ups on site, made repeated outbound calls to members who weren't responding, doubled down our outreach in the zip codes that were particularly unresponsive, et cetera. I think had we sent a letter, an email, had online sign-ups only, we would not have been nearly as successful. My point is that when normal care access patterns were disrupted, much different action had to be taken in order to equitably reach and impact our Black and Brown older adults. In terms of what we are and can do to address disparities going forward, it's probably a familiar quote or phrase for some of you, but when we know better, we do better. And I'd say Highmark is committed to this. So we have established an Institute for Social Justice, Diversity, Inclusion, and Equitable Health to lead the way in researching disparities, understanding root causes, taking actions as we uncover new things. But none of us have all of the answers yet, or maybe ever. But we've got to maintain commitment to focus on the problem, learn from the data, take action where we think we can have an impact, and continuously improve. I think the approach I talked about in distributing the vaccine was a good illustration of this. We didn't have perfect data, but we knew enough to take actions to prevent disparities, at least with vaccine distribution, and so we did. And now we'll take what we learned from that effort and improve our approach going forward.
John, can I just respond to Alexis?
Yes.
Just to say that I think that what Alexis just shared with us was an important emphasis on the way that it is necessary to think about racial justice in terms of thinking about policy and practice. It's more than just service delivery. And so what Alexis just said is that they dramatically changed the distribution process for delivering a life-saving vaccination. And so, and she also emphasized the need to double down in relation to disseminating information. That's policy and that's practice. And so what you asked earlier was, what is it that we need? Yes, we do need service delivery, but we need to rethink the way that we have traditionally approached communities of color and approached under-resourced communities, so that we are thinking about the way to engage and change the outcomes. So that is a really strong example of the way that Alexis's system changed the outcome of distribution. And we have to continue to think in that way and to make it our norm across the board for all resources when we think about how to increase the likelihood of equitable resources in every system, healthcare, just all of our systems. And I think that was an important distinction that she made.
Okay, thank you very much, Trish. The next question is a two-part question, and I'll ask Alexis and Trish to respond to this question. And the question is, since we can't talk about accessing anything during COVID without mentioning the use of remote or virtual technology, can you talk about ways technology has negatively or positively impacted the lives of older adults? And secondly, How might we improve the future of technology use for older adults? I'll ask Alexis to go first on this one.
Sure. So, overall, telephonic and video visits, became a critical part of health service delivery for older adults during COVID. That said, not everyone used them, knew how to use them, and not everyone liked them. So if I go back to pre-COVID days, older adults use virtual and tele capabilities for less than 1% of their physician visits. So in 2019, we saw about 100 televisits out of 800,000 primary care physician visits, and about 100 out of 60,000 behavioral health visits. Part of the reason is that there was a limited set of services that CMS, the federal government, allowed to be performed as virtual. Also, the government required both audio and video to be considered a paid service. So it made it difficult for older adults who might not have had access to both audio video technology, and it made it difficult for some physician offices who also may not have had processes and technology set up to support. So, now enter pandemics. In mid-2020, we saw a significant increase in virtual visits. So half of the older adults reporting at least one televisit in 2020. At the height of the pandemic, 25 to 30% of all physician visits for older adults were virtual. Anecdotally, and through a supplemental survey, we'd estimate that a third to a half of the virtual visit users were over the age of 75. And many of the visits early on in particular were telephonic only, not video, indicating not quite a full embrace of virtual. Nearly all of the visits, however, for our older adults were with existing physicians, so an extension of existing physician relationships. CMS, again, the federal government also gave some flexibility to change benefits during the year and allowed insurers to waive copays for virtual visits in order to promote them. Insurers like Highmark and most others focus a lot of attention on promoting and rewarding members and providers for conducting the virtual visits. That said, it is worth noting that in the member satisfaction surveys that, we conduct, we noticed that our older adult members who had virtual visits expressed some less satisfaction. So while we suspect that some of this dissatisfaction stemmed from feeling that COVID forced their hand to seek virtual services, we're working to better understand if there are other concerns that we can help address. Now in 2021, there's been some change. So we saw a pickup of combined audio video visits, perhaps an indicator of some more fully embracing virtual. But we saw virtual PCP visits drop, so from 16% down to 8%. Still much higher than pre-COVID, but likely decreased because things started to open back up, but the vaccine became available, et cetera. Virtual behavioral health visits dropped some, but still very high at 60% of behavioral health visits being conducted virtual. So if you think about, how we might improve the future technology use for older adults, I think first of all, we're going to see a group of older adults who will continue to use virtual visits, maybe a little less than 2021 even, but remaining higher than pre-COVID. We should take what we learned during COVID and improve. So where did we see higher use and satisfaction? Why and how can we keep the rate up? Where was there dissatisfaction and what can we do to improve? And I'd say beyond improving virtual visits, we're also working to incorporate more remote monitoring technology into our older adults' personalized care plan. So imagine, continuous glucose monitoring technology that allows, us and physicians to quickly see and react to changes in blood sugar as part of diabetes management. Or similar with a remote blood pressure cuff and managing hypertension. I'd say the last point, though, that we need to understand is that virtual visits and related technology aren't for everyone and don't replace all in-person needs. So, as we kind of continue down this path of bettering the technology, bettering the experience and utilization, we need to carefully manage that evolution and make sure that, quality care and outcomes remain the focus, whether that's, virtual or in-person visits that achieve them.
Okay, Trish?
Yes, so from a community-based standpoint, in terms of service delivery, what we noted is that in early 2020, we began engaging seniors by telephone. The majority of the senior population that we were able to support through health and well-being checks were more responsive by telephone. And as we conducted surveys internally from with the consumers that we served, what we noted is that they indicated a willingness to learn and utilize technology, but also some anxiety around being introduced to this new technology. Now, there are some other aspects that we had to overcome in terms of access to high-speed internet and also just an overall skill level. We were able to have meaningful partnerships with Comcast to help assure that our consumers were had access to internet. And then we also were able to work with key partners, the Hill District Community Engagement Center from the University of Pittsburgh and a community college of Allegheny County, who were able to help us provide technology classes that even began with, this is the turn on button for a laptop or, on iPad. And so what we were able to see is that over time, the seniors that we were working with wanted connection. The social isolation became a very real factor, and they wanted to be able to utilize these services or these resources, rather, to be able to continue to engage with friends and neighbors, and also to be able to utilize it in other important ways, such as access to religious services. So what we are noticing now is an increased desire to continue to utilize this. Now, I will say that it is important to recognize that just the access overall, not just to seniors, but overall, when the whole world shifted to a virtual model, you had all businesses, all employees who were looking to have increased orders in laptops and supplies that were needed to create a virtual workplace. That added to a prolonged delay in access for seniors to be able to connect in this way. But what we are noticing now through the rate of registration for the classes that are being offered through our community partners is an increase in desire from the seniors that we serve to want to increase their skill level. They see it as a way of mitigating some of the social isolation that they experienced during the height of the pandemic.
Okay, thank you very much, Trish. Julian, we've had you sitting on the sidelines for a few minutes, so the next question is for you. And can you talk a little bit about the pandemic has impacted the labor market, and specifically for employees and employers who have provided vital health and other direct services to seniors?
I can, John, but because we're running ahead of schedule, can I just comment on the last technology subject?
Sure.
Just from the legal perspective, because this is really important, and I don't know that people realize this has happened because of the pandemic. People have always struggled to be able to get legal services, especially in outlying counties and rural areas where those services may not even be there. one of the biggest benefits we've seen of this virtual transition has been that we're able to reach so many elderly clients and frail clients who can't get out of their homes. But for example, a family member who may be more savvy with technology has been able to bring an iPad to their home or something where we can have a consultation with those people and get them the necessary services that before this pandemic would just not have happened. And so one thing I've seen as a positive thing is that seniors have embraced the technology to the extent they can, and the extent they're willing, and they have some fostering by family members who may be more confident with that type of technology. And it's allowed us to do things that we couldn't do before. And frankly, we are on the cusp right now in this country of allowing a lot more virtual signings of legal documents. Signing simple things to us lawyers, very routine things like powers of attorney, last wills and testaments, trusts, very sophisticated documents, had a very formal signing process. There are now states that allow these things to be done virtually. So it's only a matter of time before Pennsylvania starts to allow us to have virtual signings of legal documents like DocuSign for your last will and testament and those types of things. So it's been a very, very positive thing because we've struggled for a long time to get the courts to allow us to do virtual signings or even have virtual witnesses attend meetings where we couldn't get 3 or 4 people in a room. So it's been a very positive thing. So let me transition to about your next question, which is about the labor market. You know, I alluded to earlier that we've seen a great reduction in the ability to hire caregivers in the long-term care industry, whether that's in long-term care facilities or in community-based programs that provide services at home. That's been a real struggle. And, you know, from my perspective, the tangent goes even further. It's not so much just that people can't work or are sick or are afraid to work. It's they're thinking about other people. We have a lot of caregivers and people that say, I live with an elderly person. I don't feel confident going to work in a long-term care facility and then going home and being in the same household with my elderly mother. And so, you know, we had to really think broader about what caregivers are going through and recognizing it's not always just about their immediate job function that they may not be able to do because of the pandemic. And as an employer, you know, and I'm an employer of a law firm. And so, you know, we have a lot of people in our law firm that deal with high risk categories. I have 2 social workers in my law firm that frequently would visit people in their homes, people in long-term care facilities. And we really had to change the way we did that. And it impacted our ability to have those employees do their jobs. That seems to be coming around a little better, and there's a little more, you know, flexibility now in visitation. But for the most part, it's been a struggle to hire people, I think, for employers. And now this thing keeps changing as far as the guidelines that are put forth, whether it's from CDC or the governor's office or whomever, where, you know, first we had the pandemic and that affected people. Then we had the Delta variant, and now we're talking about a mandate for vaccination and for healthcare workers. And this could be a real challenge. And so, you know, I don't think we're out of this yet. And I know that we need to be flexible as employers for sure, and recognizing that our caregiving employees are having even a more difficult time than they were pre-pandemic. We're always concerned about caregiver burnout for our caregivers. You know, as many of you know, the overwhelming majority of caregiving in this country is done by unpaid family members in the community. There's no question about that evidence. And so we need to reach those people and give them resources, whether that's through government programs or other types of training and funding. And we're not there yet, but hopefully this pandemic will help us. And just if we take it in the Commonwealth of Pennsylvania, you know, our leadership in this Commonwealth has always advocated trying to shift the percentages of long-term care being provided from a facility perspective back out to the community. And we've just never really gotten there. And it's been decades we've been trying to do this. So I really hope that from that perspective, we can give the resources to these caregivers and keep people safe in the community.
Well, Julian, what can we do to support employees and employers that are struggling And how can employers support their working caregivers?
Well, I think first of all, employers who work at least in the medical field, the long-term care field, need to recognize their employees need a break. They need to have breaks, and it's simple as that. These people are working very, very long hours under a lot of stress. It's much more different than it was 2 years ago. So I think right off the bat, employers should try to figure out ways to give their employees respite. And from my perspective, some of the things we've done personally, and we're not a healthcare obviously facility, we're a law firm, but we work with healthcare. And so one of the first things we did was allow all of our employees to work remotely. So we had to upgrade all of our technology so every employee has remote access. And now we're in the process of replacing every single employee's computer in our company with a laptop with a docking station so they can work from home. So, and they're supporting people in their family system too, so that when we have an employee who says, I'm still taking care of my elderly family member, I'd like to work remotely, 3 days a week. I think employers need to figure out how to make that work and still not let productivity suffer. And that's really what we've seen is just employers need to be flexible and understanding that this is a team effort and it's a societal team effort. It's just not about your company.
Okay, thank you. Trish, would you like to take a crack at that question?
Yeah, I appreciated Julian's responses. I thought that they were very insightful, and actually I was just reflective of what that could mean from a nonprofit perspective. I think that his point that resonated most with me was the allusion or the reference to the reference to compassion fatigue. I think that when you are outwardly facing to a community in need, and you also have your own household who needs similar levels of support, it is physically, emotionally, and mentally stressful. And it is important to be mindful of that. And if I am truly transparent, I would say that probably that is one of the areas as an employer that I could have done better in. The pandemic placed all of us in a position. I can remember thinking and having a conversation to the chief of program services at my organization, and we were literally bickering back and forth about how to make a decision, because nowhere in graduate school was there a chapter on how to make decisions during a worldwide pandemic and how to serve a community when you're of the community. And I think that Julian's point about grace, being able to extend grace, is an important one, and is one that as a leader, I am being more mindful and intentional about. But I also think that it is important for all of us to be mindful of just the weight of the impact that the pandemic has had on all of us, and particularly those of us that are in service-related fields. And it has not ended. We are still feeling the impact of fatigue, and we have to be mindful. I agree again with Julian in terms of thinking through how to give built-in breaks in the way that your service delivery allows you to for your staff. For us, it is not practical because one of our pillars is community engagement. We're in the field, so it is not practical for us, for our entire staff to work from home, but we do have a 3-day in the office, 2-day out process model. And we have begun to think about more flexibility, and we are instilling ways to provide extended breaks over the holidays for our staff so that they can be more intentional about supporting their families as well. I would offer that one can't serve from an empty vessel, and so it is necessary to be mindful of that.
Thank you. I have another question for both you and Julian, but I want Julian to go first on this one. Julian, throughout the pandemic, how has the role of informal and family caregivers changed? And what impact has this had on families and the community? And secondly, what are some ways we can support family caregivers?
Yeah, so we've seen people make really difficult choices about their careers. It's just, that's the biggest change I've seen. I've been doing this for a long time and have worked with thousands of families that have family caregivers. But this pandemic has really forced some people to make some choices about, do I want to retire early? Do I want to quit my job completely so I can take care of a loved one? And those are really life-changing choices and sacrifices that caregivers make beyond just the typical sacrifice of being a caregiver, which may not be full-time for a family member. So, that's the biggest thing I've seen. But it's also nice that, statistically, a lot of us might believe that the United States was getting more and more fragmented. The nuclear family was getting spread out more and more across this country, right? As technology, as travel becomes easier and easier. And one of the things we're seeing is kind of more families coming back together again and saying we have to stick together. We either can't afford to get caregivers around the clock, or just no one's going to have the compassion for this person that I will have. Maybe people just aren't qualified, whatnot. So the interesting thing I've seen is, more and more people are coming together as a family. And, ironically, I just did a Zoom with one of my 90-year-old clients last week and her two daughters who are sharing, and she's been my client for, 13, 14 years. And we were just having a little checkup. Number one, we normally wouldn't have my 90-year-old client would not get on a Zoom. And number two, it was nice to see that. I said, how's things working out? They said, well, each of the daughters, who are both, one's a school teacher, another one works for a financial institution, they are sharing having mom at each other's homes so many days per week. That would have never happened before too. And so they refused to place her in a long-term care facility. And so that was really a big change. And then, once again, how can we support family caregivers? We talked about it before. Everyone needs a break. We want to avoid caregiver burnout. But from my perspective as a lawyer and in the community, I think it's really important to educate caregivers on what's available. Many people don't know they can get paid as a paid caregiver through Department of Human Services or other programs. They don't know about all these programs that are out there. And I think it's our job to educate people that say, I want to stay at home, but I can't really afford to quit my job, but I want to take care of someone. And there's so many great programs out there that these people can get into. And so I think the best way we can support them right now is to educate them so they can make that transition if they'd like to do that.
Okay, thank you. Trish, can I ask you to respond to that same question?
Yes. So again, I echo a lot of what Julian offered. I would also say that for nonprofits, for my nonprofit, for a community-based organization, we did note that our staff was mindful that how they interacted within the community with consumers and what impact that had when they were going home and assuming their roles of caregivers. So they were extremely intentional and careful about just following healthcare recommendations for mitigating the transmission of the virus. And I think that played a significant role on how we operated our day-to-day process of providing services within the community. I would, again, I keep saying I echo Julian, but I think that it was difficult for some staff members who had to make important decisions. We tried to make adjustments where we could in terms of changing reporting hours on when someone would report to work, so that if they had caregiver responsibilities, they could try to start their workday earlier, but still trying to manage the fact that we have a responsibility in a community. I personally have seen some staff members who said, this is a difficult time and I have to make a difficult decision that is based on what's best for my family. And I think that that those kinds of important decisions are we're going to see people continue to make. I would also say that we are again seeing more seniors who are increasing a likelihood to engage in a different way with families. Within the community, I have noted anecdotally through our small groups, just members checking up on one another, encouraging and helping each other get on Zoom calls. I can remember anecdotally, one of our program managers was trying to engage a group of seniors in a physical activity via Zoom. And finally, he said, you know what? I just put myself on mute and off camera because they just wanted to connect with one another. And that is an important recognition on what this looks like in terms of being able to take some of the pressure off for caregivers because of the need for seniors wanting to connect with one another. So I would just offer that we, as if we are in a position of shaping the way a workday looks for employees, to be mindful of the need to be more creative in the way that we can support caregivers and family members in supporting households through the pandemic.
Thank you. Well, we're to a point now where we are about to conclude our Q&A session. But I'd like to know what final thoughts do you want to share about ways businesses, nonprofits, and individuals in our community can support older adults and loved ones? So while you're there, Trish, can you hear me?
Yes, so I would say from a nonprofit perspective that we consider it from a multi-tiered approach. So the first approach is just in terms of service delivery, being very intentional, inclusive in the way that we approach offering services to seniors and being mindful of access to resources. I would also offer that we make sure that we are linking both the senior consumers and their caregivers to resources that are available and helping to share information for evolving resources that are made available as a result of increased funds, either locally on the state level or federal level. In terms of policy, as we begin to really, and we talked a little bit about this earlier, as we begin to think about equity and more inclusive policies, I would encourage us all to think about operating from a non-traditional perspective. What we've learned through this pandemic and what has been highlighted is tradition doesn't work. And so going back to the way things were does not work. We have to challenge each other and ourselves to reframe our thinking and to reframe our conversations when we're talking about policy in terms of fiscal distribution of support, in terms of the way that we engage and disseminate information, and the way that we educate our own teams and staff about the disparities that we see, but not just the disparities, but the long-term historical impact that cause the disparities that we see, and to think about how to begin to dismantle and unravel the root causes for what we're seeing.
Thank you. Julian, your final thoughts, sir.
Sure. You know, this is an extraordinary, once in a lifetime event. And I think that everything is on the table now to rewrite how healthcare and long-term care is delivered, because people are making choices, and then they're going to make choices about how they want to live their lives in the face of this pandemic and future issues related to it. So I think we should all try to embrace this, and whether it's talking to legislators, other leadership, to say, you know, can we change the model so that, you know, we finally get this to work the way we've always wanted it to work. And so I hope that you know, we can start with a clean slate, so to speak, and take a look at some models that maybe years ago we said those are extraordinary, we can't do those. Well, now we're in an extraordinary situation. Maybe we need to look at those again. And I think that if we can get enough people to understand the true need, we all know the statistics. And isn't it interesting and ironic that we've all been seeing the statistics for the last 25 years about how many people are getting on Medicare and Social Security every minute in this country, and how many people will be over the age of 80 or 85, you know, in the very near future. Yet, what have we really done about it? And we know that the majority of that care is provided by caregivers. So this is a time, I think, for us as a country to embrace the need to come together and really look at this with a fresh set of eyes and do something really impactful.
Thank you, Julian. Lastly but not least, Alexis, your final thoughts, please.
Yeah, wholeheartedly agree with everything that's been said. You know, a once in a lifetime event. You know, the first thing I would say is, let's figure out how to use what we learned during the pandemic, whether that is, you know, the use of virtual services, the non-traditional approaches to impact, you know, disparity. Let's get some silver lining use out of it and take that forward. You know, the next thing I'd say is get involved with older adults. You know, we can all make a difference by connecting ourselves or a friend to an older adult who needs us. So the volunteer programs that we talked about, you know, helping to support decisions. We're in the middle of annual enrollment for, you know, Medicare health insurance. And so what can you do to help a friend, family member, whoever, think through what insurance coverage they need and why, and help it connect to their specific needs? And, you know, plenty of other ways to support and contribute to older adults. I think the last thing I'd mention is that we should keep asking our seniors and their loved ones what they need and how they want to be supported. I know that we rely heavily on a senior advisory panel that we work with on various aspects of our Medicare plans. You know, we also survey and listen to what seniors have to say about how they want to be communicated with, what things they need to hear about, et cetera. Did a lot of that during the pandemic, the onset of the pandemic, trying to help seniors think through the pandemic with whatever information was available at that time. So, you know, I'd say ask, listen, and see what you can do to help.
Well, thank you very much. I would like to personally thank our panelists for their participation in today's program. And I'm going to turn the program back over to Julie Design.
Dr. Wild, and thanks everyone on the panel. That was really just a great reminder of why we do the question before us, not just to emphasize the issues and the problems that have been facing us, but also the thinking about how do we move forward. And I think you've all said a version of this, but what I wrote down, what Dr. Gadson said, you know, that tradition doesn't work. We need to challenge each other and ourselves to do better. And I think all of you said that in a different way. And I think it's just so important. And another silver lining, seeing many systems such as Highmark on the longer term care facilities, really making serious disruptions, making significant changes to the way that they do business to increase access for all people, particularly those that are in low-income communities, that are in rural communities, and that are in communities of color. And these are communities that have experienced isolation to a greater degree all along, and most assuredly during this pandemic. So lots of strengths to build on. So thank you all very much for that. In terms of our call to action, if you are a caregiver or you know a caregiver who needs help, please call United Way's 211 helpline to get connected to the caregiver support program. I think there's going to be a link to that in the chat, or to one of the many programs that we're really proud to support in this area, including Age Well Pittsburgh, Macedonia FACE, Vintage, lots of Northern Area Multi-Services, lots of great programs out there. And if you are an employer, I think you got excellent advice from our panelists today, but also we have a free empowerment series to learn more about how to create a workplace culture that supports and retains employees who are caregivers, and happy to share that with you. So thanks again very much to everyone, and for all of you for participating, to Dr. Wiles, our panelists, and the Eden Hall Foundation. We will be posting the link to this session in the next day or two, and encourage you to share. And we'll be coming back at you with the next question before us a little later in the winter, which feels like might be today, but it definitely will be in a couple months. So thanks everyone very much. Have a great day.